Congenital heart diseases, CHDs, are structural abnormalities of the heart present at birth. They vary widely in their severity and can affect various parts of the heart, including the walls, valves, arteries, and veins. CHDs are typically classified into several broad categories based on the type of defect, the impact on blood flow, and the oxygenation of blood. Cyanotic congenital heart diseases are defects that result in poor oxygenation of blood, leading to a bluish tint, cyanosis, in the skin, lips, and nails. Examples include tetralogy of Fallot, TOF, a combination of four defects: ventricular septal defect, VSD, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta, transposition of the great arteries, TGA, where the aorta and pulmonary artery are swapped, tricuspid atresia, the absence of the tricuspid valve, total anomalous pulmonary venous return, TAPVR, where pulmonary veins drain into the right atrium instead of the left, and hypoplastic left heart syndrome, HLHS, where the left side of the heart is underdeveloped. Acyanotic congenital heart diseases do not cause cyanosis because they typically don't severely affect blood oxygenation, though they may cause other significant circulatory problems. These include atrial septal defect, ASD, ventricular septal defect, VSD, patent ductus arteriosus, PDA, pulmonary stenosis, aortic stenosis, and coarctation of the aorta. Obstructive lesions are characterized by the obstruction of blood flow within the heart or its major vessels, leading to increased workload on the heart. Examples include aortic stenosis, pulmonary stenosis, and coarctation of the aorta. Complex congenital heart diseases involve multiple defects, often including both cyanotic and acyanotic components. These include single ventricle defects, such as hypoplastic left heart syndrome, HLHS, where one ventricle is underdeveloped, and double outlet right ventricle, DORV, where both the aorta and pulmonary artery arise from the right ventricle. Miscellaneous congenital heart diseases include defects like Ebstein's anomaly, a malformation of the tricuspid valve, and COR triatriatum, where the atrium is divided into two chambers by a membrane. Syndromic congenital heart diseases are associated with genetic syndromes or chromosomal abnormalities. Examples include Down syndrome, trisomy 21, commonly associated with AVSD or VSD, Turner syndrome, often associated with coarctation of the aorta, and DeGeorge syndrome, 22q11.2 deletion syndrome, associated with TOF and other outflow tract abnormalities. This classification aids in the diagnosis, management, and treatment planning for individuals with congenital heart diseases. Each category requires different medical and surgical approaches tailored to the specific defect and its physiological impact.